Antibiotics are some of the most powerful and life-saving medicines ever discovered, but many people still don't understand how they work or why misusing them can be extremely dangerous. In this video, we will explore the real science behind antibiotics in a simple and clear way. Antibiotics are designed specifically to fight bacterial infections, not viruses, and this is the most important thing to understand. When you take an antibiotic like amoxicillin, it enters your bloodstream and begins targeting harmful bacteria by either killing them or stopping their growth. Imagine bacteria as tiny living organisms trying to multiply rapidly inside your body. Antibiotics act like soldiers attacking and weakening them so your immune system can finish the job. But here's the catch: antibiotics need to be taken exactly as prescribed, for the full duration, even if you start feeling better. Stopping early can leave behind stronger, tougher bacteria that learn how to resist the antibiotic. This phenomenon is known as antibiotic resistance, and it's becoming one of the biggest global health threats today. Misusing antibiotics, such as taking them without a prescription, using them for viral illnesses, or sharing leftover medicine, gives bacteria a chance to become smarter and stronger, making future infections harder to treat. Now that you understand the basic idea of how antibiotics attack bacteria, let's go a little deeper and talk about the different types of antibiotics and how each one works inside your body. Not all antibiotics are the same. In fact, they can be divided into several groups based on their mechanism of action. For example, penicillins like amoxicillin work by damaging the bacterial cell wall, causing the bacteria to burst and die. Another group, macrolides such as azithromycin, interfere with the bacterial ribosomes, which are the structures needed to make proteins. Without proteins, bacteria simply cannot survive or multiply. Then we have fluoroquinolones like ciprofloxacin, which attack the DNA replication machinery of bacteria, stopping them from growing and spreading. Each type has a specific target, and doctors choose the right one based on the kind of bacteria causing the infection. But what's even more important is that antibiotics don't just target harmful bacteria. They can also affect some of the good bacteria living in your body, especially in the gut. This is why some people experience stomach problems or diarrhea during antibiotic treatment. To protect your body's natural balance, healthcare professionals recommend using antibiotics only when absolutely needed and never taking strong antibiotics without proper diagnosis. Understanding the differences between antibiotic classes helps us appreciate why certain medicines are used for specific infections and why using the wrong antibiotic can be both ineffective and harmful. As we wrap up this important topic, it's crucial to understand the real dangers of antibiotic misuse and how it affects not just you, but the entire world. When antibiotics are taken incorrectly, such as skipping doses, stopping treatment early, or using them without a proper medical diagnosis, surviving bacteria gain the ability to resist the medicine. These resistant bacteria can then multiply, spread to others, and cause infections that become extremely difficult or sometimes even impossible to treat. This is why diseases that were once easily cured now require stronger, more expensive, and more dangerous antibiotics. In some cases, no antibiotic works at all, leading to severe complications and hospitalizations. Antibiotic resistance doesn't happen overnight. It builds gradually every time antibiotics are misused, which is why doctors are becoming more careful in prescribing them. Another key point is never to demand antibiotics for viral illnesses like the flu, common cold, or sore throat caused by viruses. Antibiotics simply cannot kill viruses. Misusing them in such situations only destroys healthy bacteria in your body and contributes to resistance. To stay safe, always follow your doctor's instructions, complete your full treatment course, avoid sharing medicines, and never self-medicate with antibiotics. By using antibiotics responsibly, we protect our own health and help ensure these life-saving medicines remain effective for future generations. If you found this explanation helpful, don't forget to like the video, subscribe to the channel for more health and pharmacy knowledge, and share your questions in the comments so we can guide you better.